As we get closer again to the next legislative session here in Texas, some people are keeping a close eye on the budget. That includes those who work in children's mental health. To give us some insight, Texas Tribune's Karen Brooks Harper joins us to talk about her story published today entitled "State Leaders Won't Commit to Specifics About How Much They Might Invest in Children's Mental Health." Karen, thank you for joining us.
Thank you. Hello.
Why do health providers feel as though children's mental health is not a priority for this legislative session?
It's very early in the session to get true commitments from any of the leaders and the budget writers. We know that the mental health community knows that. They fear that because there is no early requests for specific amounts of new money for the next biennium, that they will get lost in all the requests from all the other agencies and all the other people. See, the Department of Human Services, which does most of the mental health funding in Texas for the public agencies, has not landed on a number yet in terms of how much new money they want or they may ask for. So it's got people nervous. You know, they don't have a, they feel like they're not yet getting a seat at the table, or they worry that they won't.
We've also heard about promises made on mental health services, especially after the Uvalde shooting. What do some of those plans involve?
Well, one of the big ones, kind of the marquee piece of Governor Abbott and Speaker Phelan, among others, comments about child mental health funding earlier this summer was to expand the program that is part of the Texas Child Mental Health Care Consortium, which was created a few years ago. They want to take that statewide as telemedicine services connected to schools, to the public, the institutions of higher education, experts at those places. They come together to come up with treatment plans for these kids. It's a comprehensive program. It's still growing, but that's one of the things that the state leaders have said that they want to take statewide and are directing them to take statewide. Beyond that, we don't know how much they're going to give or want to give to communities and schools in terms of new money. We don't know how much they're going to give to the local mental health authorities in terms of new money. We know what their base budget requests might look like. But the thing to remember too is that none of that is true until they pass the budget in next May. So it's all kind of theoretical right now anyway.
And your report highlighted this 2019 analysis by the Texas Legislative Budget Board showing funding for mental health care has increased, but it's not keeping pace. What are some of the challenges that health providers are facing right now?
Their biggest thing is that they're having to kind of figure out how to squeeze in so many more kids. And this is an issue for adult, patients or clients of local mental health authority services and public mental health services, is that they're all running over over what they expected to, or what they had thought they would be treating, and they've been doing that for years. But now you've got staff shortages across the board. You're hearing that on all kinds of state agencies, and you're seeing it in the mental health community too. And you put that up against all these kids and families who are looking desperate for help, who are having to go on waiting lists, or they're being, preferred to other providers, or maybe their care is being, you're trying to squeeze so many people into a system that's not budgeted to take care of all that. And they do it. They bring them in. They do the best they can. But it's a big challenge for them. Staffing is a challenge, and is a huge challenge. Yeah.
Karen Brooks Harper, thank you so much for your reporting on this, and we will continue to check in with you about this as the session moves forward. We appreciate it.
Thanks very much. I appreciate you.
And we'll be back, everybody, so stay with us.